Thank you so much, and welcome everyone. First, let me applaud the Center for Lyme Action for hosting this important discussion and for doing trips and visits all over the Hill to educate members of Congress. That is really important. You are making a real difference in raising awareness about and improving diagnostics, therapies, and prevention for tick-borne diseases. I was talking with one of my staffers on the way down about the explosion in the number of ticks in the state of Maine, and how I have a black lab, and it's very hard to find ticks on a black lab. And how ironic it is that she's protected against Lyme disease and I'm not.
That's
and
right.
Think about that.
Yeah.
It shows that we have a lot of work yet to do. So Lyme and other tick-borne illnesses continue to be a major health concern, and the incidence is increasing. It is estimated that some 500,000 Americans are infected with Lyme each year, a stunning increase of about 1,400% in the last 20 years. In my state of Maine, we recorded a record high 3,200 cases last year, and experts predict an increase in the tick population this year because our winters are no longer consistently cold enough to reduce their numbers. A great challenge we face is that far too many Americans with Lyme disease experience a complex diagnostic odyssey that takes months or even years. I will never forget talking to Paula Jackson-Jones of Damascotta, Maine, who told me her harrowing tale that it took 2 years, scores of tests, 23 different physicians, and $250,000 in medical expenses before finally finding out that she had Lyme disease. Paula, as many of you may know, went on to found an effective Lyme support organization in my state. A correct and early diagnosis can reduce costs and improve the prognosis. We have a long ways to go, but I'm encouraged that we're making progress. Nearly 6 years ago, in October 2019, my friend and colleague, former Senator Kay Hagan of North Carolina, passed away due to a tick-borne illness. Before the year's end, as has been mentioned, the Kay Hagan Tick Act that I co-authored and named after Kay was signed into law. This bipartisan bill established a more comprehensive approach to address Lyme and other vector-borne diseases at the national, state, and local levels. The Tick Act requires HHS to develop a national strategy for combating vector-borne diseases. This strategy, released in February of 2024, clearly outlines the public health threat posed by vector-borne diseases. It also defines strategic goals to combat the threat and seeks to better coordinate programs and activities across the federal government, including data collection, research, and the development of diagnostics, treatments, and vaccines. The strategy sets a target of reducing the number of Lyme disease cases by 25% by the year 2035, just 10 years from now. Now, I'll admit that that's probably an ambitious goal, but I will tell you, if you don't set an ambitious goal, you don't make progress. And I'm pleased that we have seen developments, such as the first ever clinical trial for a Lyme disease vaccine for people. And I am proud that it's underway in the great state of Maine right now. And in fact, my niece is working on it.
No.
Developments like this, however, will only continue if we keep the momentum going and continue to fund biomedical research at a robust level. No more slashing and recalling grants.
Nice.
The combination of bipartisan support in Congress, private sector philanthropy, and your effective advocacy is producing remarkable results. As the Center noted last year, federal funding to combat Lyme and other tick-borne diseases has totaled more than $405 million from fiscal year 2021 to 2024. We achieved increases for Lyme-X, the K-Hagen Tick Act, and the CDC Lyme and tick-borne disease prevention programs. And as chair of the Senate Appropriations Committee, I want to assure you of my continued support for this essential funding. I oppose OMB's proposed cuts to NIH funding, as well as the CDC and FDA. To be sure, ineffective programs must be identified and cut back, but we need a surgical approach, not a sledgehammer. And we need
Or a chainsaw.
And we need to make sure that America keeps leading the world in biomedical research. And I held the first hearing in all of Congress on this issue just a couple of weeks ago. That's how strongly I feel about it. So at that hearing, we heard from Dr. Herman Haller, the president of Maine's world-renowned MDI Biological Laboratory, who confirmed my view that and all the witnesses did, that the administration's proposed arbitrary 15% cap on certain, what they call indirect costs, but they're essential to research, essential, would severely hamper the ability of the independent labs like his, as well as our university and medical centers throughout the country to advance life-saving research and biomedical breakthroughs. America's edge in biomedical innovation is of immense value, both in terms of the economic benefits and the human health. We must not lose momentum in research to combat the serious diseases that can be caused by tick bites. I'm just going to end with my own tick bite story because there's a lesson in it. So on a weekend, one summer, just 2 summers ago, I happened to look down and on my calf, I had the telltale bullseye rash. Not everybody gets that, I realize, but fortunately, I knew what that meant, And that's why I want to encourage your educational efforts as well. So I called the doctor on call and immediately was placed on, I think it was doxycycline, and I took it for 3 weeks. They first gave me 2 weeks. They could still see the bullseye rash, so they extended it another week. But I thought of how fortunate I was that I knew what that meant, and I knew I needed to get on doxycycline right away. So as part of our efforts, let's keep educating people on what to do if they have symptoms. I have another niece, not the one working on the vaccine, who has had Lyme disease 3 times. And her joints hurt, there's permanent damage there. And that's another reason why we just got to keep pressing forward with the research, with better means of diagnosis, and we are making progress. So let me just thank each and every one of you for being here and for continuing your important work. Thank you so much.